Fetal alcohol syndrome. This is September. On the 9th of September every year is a day we are aware of a syndrome called fetal alcohol syndrome. It is advised that on the 9th month every year, no woman should consume alcohol, irrespective of whether you are pregnant or you are not pregnant. This is in support of fetal alcohol syndrome, which is a syndrome which is found in children who are born from mothers who consume alcohol during pregnancy. Fetal alcohol syndrome is a recognizable pattern of malformation that occur in children who are born from mothers who consume alcohol during pregnancy. These children are exposed to alcohol while still in the mother's uterus. A mother who drinks alcohol during pregnancy or just before you fall pregnant is likely to develop a child with fetal alcohol syndrome, which will present with various somatic and mental abnormalities. Some of the abnormalities are the craniofacial abnormalities. The facial aberrations include small eyes, small palpebral features, which on the medial side of the eyes, there's a fold called an epicantic fold, which looks like the upper eyelid is falling on the lower eyelid. And the nose is a small nose which is upturned or face forward. It's as if this baby doesn't have a nasal bone. The nasal bone is hypoplastic and underdeveloped, thus forming this short nose. In a normal person, there is a furrow or a trough between the nose and the mouth. In a baby with fetal alcohol syndrome, this furrow is indistinct or is absent philtrum, and the upper lip of a baby with fetal alcohol syndrome is distinct, is a thin upper lip. And the jaw, if you look at the chin of the baby with fetal alcohol syndrome, is a small retracted chin. It's like the lower jaw is malformed or is not formed properly. You've got a small chin, which is called micrognatha, and the face is flat. And these children, because they were exposed to alcohol in utero, they were growth restricted while inside the uterus. So they have got short stature, and thus they are small for gestational age. During pregnancy, you find that they will tell you that this baby is 5 months, but it looks like the baby of 3 months or 4 months. The pregnancy is always delayed. And the head of a baby with fetal alcohol syndrome is a small head, which is called microcephaly. These are the features of a baby with fetal alcohol syndrome. You look at the nose, is facing forward or upturned, and the upper lip is thin. It's got a very thin upper lip with absent philtrum. Somewhere here you should have a furrow which is called a philtrum, which is absent, or if present is just indistinct with thin lower limb. It's got all these features patients with fetal alcohol syndrome. And it's looking at them like this, you can see very distinctly that she doesn't have any philtrum here, and the upper lip is thin. In a baby, in an African baby, it can look more or less like this. You'll recognize it very well because you're used to this color. These are many features. They can also present with difficulty in hearing, heart defect, problems with kidneys, and all other social ills. One thing that will bother every parent is to have a child with low IQ. No parent wants to have a child with low IQ. And these children have got delayed milestones. Delayed milestones meaning that if a baby is supposed to start sitting at about 5-6 months, this one will start sitting after a year. If the baby is supposed to walk at about 11-12 months, this baby will learn how to walk after 1.5 years or so. And even at school, they've got learning difficulties. They are not easily accepted or adapted in normal schools. And in South Africa, we don't have many schools where we can put these children with special needs. So the best thing is to avoid having such babies by avoiding alcohol during pregnancy. In order to have these babies who have got poor attention, easily distractible, poor judgment, and teachers can cope with this baby. The brain and the nervous system is one that's mostly distinctly affected, although other systems are also affected because they've got poor coordination and balance, and then this intellectual instability and learning disorder with development milestones which are delayed. The memory is so poor that they don't retain anything, and they've got a problem with attention. They can't pay attention for a short time. They've got what you call attention deficit disorder with hyperactivity, with poor judgment and changing moods. They are very difficult children to cope. And then there are also social ills that come together with this fetal alcohol syndrome. They're always bullied at school, they are fighting, the problem with behavior, and then they don't have a concentration span is very low. They can't do one task for a long time. They have difficulty in planning or working towards a certain goal. So, how does this thing happen? You know, alcohol, if we drink alcohol while pregnant, it can cross the placenta and go into the baby. So it means if you would drink alcohol and you are drunk during pregnancy, you must know the baby is also drunk. And if you can get drunk by, say, 5 cans, the baby, because he's small, can get drunk by drinking maybe a teaspoon. And this interferes with formation of organs, interferes with organogenesis and development of other body parts. That's why you have got these abnormalities and congenital abnormalities. The mechanism is that alcohol interferes with supply of oxygen to these organs that are forming. And in supply of this oxygen, some of the cells are killed, that it's killed by alcohol, they die. Most people in the central nervous system find that some of the nerves they die because of alcohol. Thus you have got this low intelligence quotient. On history, you can diagnose that this mother is going to have a baby with fetal alcohol syndrome, or this baby has got fetal alcohol syndrome because the mother was consuming alcohol. Or antenatally, if they were telling that the baby has got intrauterine growth restriction, is not growing very well, the pregnancy is small for its gestational age. And also the baby inside the womb is swimming inside a fluid called amniotic fluid. The amount of amniotic fluid in mothers who takes alcohol while they're pregnant is very small. So the baby doesn't have enough fluid to swim in and develop and grow normally. This is because alcohol itself is a diuretic. You realize that if you take alcohol, you go to the toilet many times to pass urine. So alcohol drains all the fluid from the mother. So the mother doesn't have enough fluid to produce amniotic fluid. And this can be seen also in the antenatal period by ultrasound to see oligohydramnios and growth retardation. As the child goes to the clinic during immunization, what we call well baby clinic, they chart them on a graph, and you find that this baby is always below the 10th centile on that graph. Irrespective of how nutritious the food that you feed the baby, you will never gain weight. You become stunted. It doesn't gain failure to thrive. They fail to thrive. And with all these facial features, you will ascribe that failure to thrive to fetal alcohol syndrome. And this central nervous system damage will come in the form of delayed milestone and low IQ. This is because of antenatal exposure to alcohol. If you look here, This is a normal baby that every pregnant mother will love to see during pregnancy if it goes for a scan. Unlike a baby with a nose that's upturned, epicanthic fold, thin upper lips, or a baby who is growth retarded with very little amniotic fluid or oligoamnios, if you look at this baby, is emaciated. The ribs are just visible. It's like the baby is starving, or is from the mother who is starving. There's no subcutaneous fat. It's just a bony skeleton, even antenatally. And this is going to persist even after birth. That's why they are always below the 10. No, I've just said that the drinking mother is feeding his child with alcohol. A pregnant drinking mother is feeding his child with alcohol. And the effect of this alcohol is unpredictable. You can never know what it is. It's different, it varies. And it's dose dependent. You can't say little alcohol will cause little effect, more alcohol will cause more effect. You will not, any dose of alcohol will produce fetal alcohol syndrome. And the effect of fetal alcoholism is lifelong. Once the baby is born with it, there's nothing you can do. You're just going to live with that. And alcohol has got no nutritional value, got no vitamin, nothing. It's not food. So no amount of alcohol is safe during pregnancy. Even a tot is not safe. Although a large amount, large binge during pregnancy will produce more effect than small amounts, but any amount will produce fetal alcohol syndrome. So the treatment of fetal alcohol syndrome is avoidance. The best treatment is prevention, which means no pregnant woman should drink alcohol. If you drink alcohol during pregnancy, you are risking fetal alcohol syndrome. If planning to stop taking alcohol, there are a lot of help out there. Organizations like Alcohol Anonymous, and there are various websites where you can get support groups that can support you not to take alcohol during pregnancy. The message of this presentation is that no woman should take alcohol if she's planning to fall pregnant or if she is pregnant. Thank you.